Greetings, everyone. So, I just want to welcome you on happy first day of LGBTQIAPP Pride Month. Happy day. We got here 2021. Who knew we'd make it? Thank you for joining us for this us LGBT senior housing and care and our long-term care ombudspersons for this informational session on the New Jersey legislation numbered S for Senate 2545. It's the LGBTQI Long-Term Care Resident Bill of Rights. In this session, we're going to be using the acronym LGBTQI to conform with the legislation, but it represents all persons in the community, the LGBTQIAAP plus community, meaning and. The definitions of all the acronyms of the acronym are included in our LGBTQ affirming and sensitivity training programs, and many programs that provide this information. And the translations are something that's required in the legislation as well. Before we begin, I want to do a little bit of housekeeping for everyone in attendance. We're leaving an open mic for all the panelists. So in the chat room and the Q&As, you can ask any panelists you see, and I'll introduce everyone a specific question. And we're keeping all you guys on mute, so there's no background noises. You won't be able to talk directly. So please feel free to raise your hand or put something in the chat room or the Q&A room, and cat wave to everyone. Will be fielding and facilitating the discussion rooms in that way. I think you should have, if you're old school, a pen and paper, or if you're new school, any of the digital platforms or digital machines. See, LGBT, older adult care, like me. So I'm having a pen and paper. I'm old school, but anything you need to take notes, we're going to be sharing some important information. The first of which is our email address for follow-up and questions, which is info@lgbtseniorhousingandcare.com, spelled out. We make you commit to our email address, lgbtseniorhousingandcare.com, info at. So after this, you can email with any further questions or to talk about training. So we're also going to send you, after the session, a training document, a worksheet, which will help you organize what you have to do as far as training is concerned and meet those deadlines. And if we have time, I'll show you what it looks like, but we're going to constant contact it out to the whole list. So if you don't usually open your constant contacts, please look for ours. It may end up in your spam. Click you're accepting them from us that time and in future, so you can keep up with legislation and other things that are going on in New Jersey and across the nation. Let's see. Oh, so now I'm going to introduce our team. LGBT Senior Housing and Care is a group of lesbian, gay, transgender, and bisexual persons, advocates who have worked together to create a program that provides culturally sensitive, affirming, and welcoming LGBTQI training, not only in long-term care and healthcare, but in professional services for public sectors, to help align services and care with the needs of the LGBTQ older adult population and employees who are from the LGBTQI community. So I'm going to introduce our team. You can't see all of them here. This is just our panelists, but I wanted to introduce them by New Jersey. This is our New Jersey team by New Jersey region. Richard Hinkman, He, his. Richard is a very active LGBTQ advocate in South Jersey and in the Philadelphia area, my hometown. He heads up the Garden State Equality Elder Network Task Force and has a master's degree in divinity studies. Randy Schwartz, she, her, is also from South Jersey. She's an RN and she has a career that spans for a long time in long-term care. She's worked in prison medical care, so she understands that system. She's had a long career in sales and sales training. So Richard and Randy have come on in 2021. We're excited to have them. In mid Jersey, we have our newest person, but also one of our oldest, Graham Davis, he, him. Graham was an original founding member of our focus group and has joined our team as an affiliate and trainer. And he's an occupational therapist with a lot of experience in long-term care and advocacy for LGBTQ rights. And on our panel, also from Middle Jersey, is Bianca Mays, she, her, known to many of you as an expert in LGBTQI health training and study. And her latest work is on our resource page. She's author of an academic paper with Monmouth County University. And Bianca has a master's in public health. She's a certified health education specialist and, again, a founding member of LGBT senior housing and care when we were just the little engine who could focus group. So we're so excited to have Bianca and Dr. Tyree Aradian, she, her. Bianca has a doctorate in public health. She's a program director of Lead for Diversity Institute. She teaches as an adjunct professor at Montclair University. She's our director of health education. And Kat Verity, our powerhouse, she, her, a longtime senior living and healthcare advocate for families. She is a support group facilitator for the New Jersey Alzheimer's Association, and she has a really long list of roles in healthcare and senior care. And if you email her and she emails you back, it reads like a novella at the end of her email. So you could, we don't even have time to read it all now. And in North Jersey, we have Dr. David Rosen, my partner in crime, he, him, Director of Education and Training for LGBT Senior Housing and Care, and a founding member. David is the clinical director at Hudson Price Center of New Jersey and a part-time lecturer at the Graduate School of Social Work and Rutgers University. Then there's me, Amy Simon. I'm responsible for putting this band together. My career has been in communications and public relations, and I've spent a lot of time in communications and business development for-profit, nonprofit, and policy, which got me involved, and then in healthcare. So I spent almost 10 years in working with long-term healthcare. And so it's all come together. This is where my experience first began to understand the LGBTQ community and the needs that weren't being met. And thus, this band started playing for real. So our panelists also include, very excited to introduce Lori Brewer, who is from the New Jersey office. She's a long-term care ombudsperson. And Lori became the ombudsperson in 2019. And the office advocates for residents of long-term care facilities by investigating allegations of abuse, neglect, and exploitation. She was in the office as chief of staff for 9 years before they gave her the crown. And as you can imagine, Lori's had a pretty trying year during this pandemic, a year and 15 months now. And she never lost her commitment for the LGBTQ older adult community and continued to keep her eye on the ball of this legislation while, Rome was burning. And we really, really, really appreciate that. And with Lori is the right-hand woman for the main woman, Amy Brown, she, her, She's an attorney and director of outreach and advocacy in the Office of the Ombudsman, works focusing on institutionalized elderly. She's an advocate specializing in issues affecting the institutionalized elders, including residents' rights, improper discharges and transfers, and end-of-life ethical conflicts. And Amy was and continues to be one of the main voices for LGBTQI elder rights in and out of the system. And hooking up with Amy and having our first meeting was really the door opening on everything we're about to discuss today. So welcome to the panelists. As we continue, I think we should really start by having Lori tell us about the Ombudsman's office and background of the LGBTQI long-term care Bill of Rights and why it was so important. So take it away, Lori.
Thanks so much, Amy, and thank you for inviting me to be a part of this incredible panel. And I do want to give a shout out. Obviously, I am so proud to live in a state that would actually pass this legislation and to work for a governor who would sign it, and to live and work in a place where the voices of the LGBTQI community are heard, particularly in reference to this issue. There are very few other states that have this kind of legislation, that kind of have this kind of state law. And I'm going to be honest, it showed up. Okay, we learned about it and immediately embraced it. And I was immediately happy to see that in putting it together, the people who put it together recognized that the Office of the Long-Term Care Ombudsman was the right place for the complaints about discrimination or abuse, neglect, and exploitation related to LGBTQI status should reside. Those complaints should come to us because we are the premier advocacy organization representing residents in long-term care facilities. So again, I'm very proud to live in a state to work that would do something that would do this. Got to give a shout out to the sponsor, Senator Singleton. We worked with his office, his aide, Assemblywoman Huddle, all the other many sponsors. Amy, you referenced kind of a work group that immediately we worked to put together. You assisted us with that. People from your organization, from SAGE, Garden State Equality, Barnabas Health Diversity and Inclusion Office, Graham Davis, who's just great, also a volunteer for us. So many people who helped kind of advise us on this. And the thing that we recognized right away, in consistent with the whole panel here, is that training was absolutely critical, and the right type of training was absolutely critical, and that we needed to set realistic expectations around training and make sure that there was someone in management and in direct care who were designated to start this process of being trained. So I'm so honored to be a part of this. Just quick overview of the office. We are advocates. We receive our complaints by phone, by mail. We have investigators who respond to those complaints, who go to the long-term care facility, speak to the resident, get consent from the resident to proceed to investigate. And what we do is we work to resolve issues to the satisfaction of the resident. Complete confidentiality is assured. So I think we are certainly the right agency to handle these complaints. I'm very honored to do so and to be a part of this very important panel. So thank you, Amy.
Great. Thank you so much. We really appreciate everything you do. I'm going to just move ahead and do the presentation on the legislation so everybody knows exactly what we're talking about, and then you all can direct your questions in the chat the Q&A, right, Kat? So you'll be following both, and then we will answer any questions that you have. So hold on one second while I get this all together. I'm going to share screen. So let me slideshow start. And let me share screen. Share screen. Hold on. I have to figure out how to share screen. I'll do it. I always do it. Let's see. Share screen. Ta-da! Who sees me? Who sees the screen? Do I have it? Okay, I have my whole panel shaking their friggin' head now. Now? Yay! Okay, my children would be so proud. Okay, so we're going to begin. New Jersey legislation, effective date September 9th, which means that is the day the clock starts ticking. So it's June. It was signed in March. Effective date was 6 months from the signage date, which brings us to September 9th for the LGBTQI Senior Bill of Rights legislation for long-term care facilities. Why now? Well, 4.5% of adult Americans, up to 9.5 million, openly identify as lesbian, gay, bisexual, or transgender. 2.4 million are 65 years and older. And by 2030, that number is expected to rise by 50%. This is from a 2017 Gallup poll. And everybody should know that gathering data is very challenging. It is not a sexual orientation, identity, expression are not included as identifiers on the US Census or any other government document. So actual hard numbers are difficult to determine. Millions more of the family members, friends, healthcare decision makers, and healthcare and professional service providers are LGBTQ and their allies. 20% of the LGBTQ older adults are people of color. And by 2030, it's estimated that LGBTQ older adults ages 50 and older will number more than 5 million, and by 2060 likely be high as 20 million. So when you think about your residents in your communities, the need for the training is going to grow. And we're talking not by decades, every couple of years, it's going to grow as more people are out, more family members are out. And you can see 1 in 6 Gen Zs on the latest 2021 Gallup poll have declared LGBTQ. So the number will continue to rise. So older adults are less likely to have close family as they age. They're more likely to face discrimination in housing, less financially secure, that's very important, and continue to face an array of unique barriers and inequalities that stand in the way of a healthy and rewarding later life. The challenges are magnified in the LGBTQ community. LGBTQ elders have all of the same fear of aging, isolation, physical and mental health, older barriers, everything that every adult is facing is magnified in the LGBTQ community as a result of their life that's been lived in fear, that they've experienced discrimination and harassment for their gender identity and their sexual orientation. So it adds additional barriers for them to overcome when they come into care. And many who are out of the closet go back into the closet, meaning hiding their sexuality due to fear when they come into care, fear of discrimination, shame, and violence. So the mission of the legislation of New Jersey meaning Senate 2545 LGBTQI Bill of Rights for long-term care is to provide critical legal protections from discrimination for the community and for HIV positive residents in long-term care facilities. And that's important. It's not just those from the LGBTQI community, it's also HIV positive residents. To ensure LGBTQI residents and long-term care facilities have equitable access to health care, regardless of their sexual orientation and health status. Equitable is an important word. Equitable has greater measurement than equal. And to enable LGBTQI residents in long-term care facilities to live safely and with dignity. So the training goal of the legislation is to care for LGBTQI seniors and seniors living with HIV and preventing discrimination based on sexual orientation, gender identity or expression, intersex status, or HIV status. It includes two parts. We break it out into two parts. There's non-discrimination policies, all the things you must stop doing. And there's affirming and welcoming policies, all the things you need to implement. So if you think about it as I call it a stop go. So let's talk about go. Training is the foundation of this work. The training, the bill requires, as Lori mentioned, 2 staff per building, not company, per building are trained. 1 must be direct care staff, RNs, CNAs, medical care, social workers, and 1 administrator. I like the idea. We like the idea of it being the executive director, but it can be anyone from the executive level, administration level. They need to be trained within 6 months of the start date. So by February 9th of 22, they need to be trained because they're responsible for the training plan. So we recommend they get trained right out of the gate. Don't wait till this time because they're responsible for putting together the plan that needs to be given to everyone in the community within a year of the effective date. So that is going forward the next September. Everyone in the community needs to be trained within the first 12 months and then biennially, every 2 years. Everyone needs to go through the training again. And everyone means your per diem people, your part, full-time, on-site vendors, dining staff, maintenance facility, even if they're not your employees and it's a vendor company you use, if they're on property, they need to be trained. And when you have onboarding your staff, the legislation says within 12 months of hire, we recommend immediate as part of your onboarding. There's no sense having any mistakes or not being aligned with the practice that the whole community is establishing from the get-go. So in the training, legislation requires 5 distinct areas of training. Terminology. Everyone needs to be trained in terminology of the community, common terminology. Best practices in care to the LGBTQI plus community. That's pretty expansive because within the acronym are a dozen different communities with different healthcare disparities and different histories and cultural experiences that all best practices need to be developed for everyone in the community. It's a really person-directed care, of which you're very familiar. History needs to be covered. History not only of discrimination and bias through time. We begin our training with the 1940s only because the clients and the residents you have now will have experienced from the 1940s forward. But the full history, how they say your history is in your DNA, goes back to, indigenous peoples, Judeo-Christian, the founding of Judeo-Christian conditions. So it's a really interesting study, and the history and the healthcare disparities and the health disparities and morbidities of the different segments of the LGBTQI community, which are vast. And then in establishing affirming and welcoming environments for the community. So that's a whole separate section of, how to, what to do, how to make it very effective in your long-term care community and create sustainability, which is really important. And then the fifth thing that's required by legislation is reviewing the contents of the bill and reviewing with everyone so they know exactly what the law is and exactly what's required, so you don't get in all kinds of trouble with Lori at the Office of the Long-Term Care Ombudsperson. So it's good to know exactly what you need to be doing. So what else one should be doing is always, from the legislation, always identifying to someone by the pronouns that they choose. And here's a sample of some of them. I introduced us by our pronouns. What is your pronoun? Always introduce someone by the pronoun that they choose. You must, if you don't have an anti-discrimination pledge or sign in your lobby or on your lobby table, you should anyway. But in that anti-discrimination policy, this paragraph must be included, to include that you don't accept discrimination or harassment, bullying, or abuse on the basis of actual or perceived sexual orientation, gender identity, gender expression, intersex status, or HIV status, or based on an association with another individual on those same statuses. The LGBT senior housing and care anti-discrimination signage is a little more, has a little more that we recommend. So, but this is the minimum that, and the exact words that you must include in your anti-discrimination signage, and you must post it. All your resident records, forms, and applications must include gender identity, chosen name, and pronouns. Chosen name, the name they use, a person uses, might be different from the legal name they were born with. So you need to include those names. And transgender specific access to transition related assessments, therapies, and treatments as have been recommended by the resident's healthcare provider. We have a lot more on this, a lot more about Medicare and how they may or may not cover it, the differences state to state. But in New Jersey, you're required, if it is prescribed or recommended by their provider, to continue their therapy, their treatments when they go into long-term care. So these are all the don'ts, right? All the non-discrimination policies. You cannot discriminate against LGBTQI persons or HIV positive persons of admissions. You must admit. You are not allowed to transfer them based on those statuses. Room assignments, you cannot discriminate for room assignments or room transfers based on sexual orientation, gender identity, HIV status. You cannot exclude the community from using the public restroom of their choice. So you need to have a restroom in every public area where you have public restrooms that can be used by everyone, and nobody should be harassed for their choices. You should not discriminate by legislation about gender expression of any of your residents or your staff members. There's a lot of discussion there for the administration about how to manage that. Association, who one hangs out with, who one's friends with, sexual relations, as everybody knows in long-term care. There is sex, and when the lights go out, people are finding comfort in one another, and you cannot discriminate from public displays of affection between same-sex couples. So we could talk to you more about how to have safer relations in your community with your elders. There's a lot one can do to be positive and to be safe. Resident health services. So you may not discriminate. Any service that an LGBT community member requires, physical health, mental health service, daily care task services, and cultural services. You must not discriminate. You need to include that in the policies and procedures of your long-term care environment. And privacy. Privacy is very interesting because in a lot of ways, we're telling you to take a lot of information that isn't necessarily protected by HIPAA, but we're saying you need to protect that information. So informational, pronoun use, gender identity, sexual orientation. You need to know if one of your clients, one of your residents needs to keep that private or doesn't need to keep that private, what your institutional policy was going to be. And very interesting, physical privacy, which is great for everyone. I know in the rush to get work done, you're understaffed and overburdened, and sometimes these things are overlooked, but the use of privacy screenings when performing daily tasks and bathroom use and closing room doors and creating privacy between roommates when tasks are being done is very, very important. So that's required by legislation that you always have a barrier and create privacy for your residents during those times. Now, this is about budgeting, and in policy and in legislation, you might have heard the term unfunded mandate. So this is another unfunded mandate, which means you need to accept the financial responsibility for doing this training, and it will require an investment at onset. For those of you who have, your calendar years of July to July, it's going to be a little tough. You're going to have to eke out your first budget from what funding might be available to you. For those of you who do, an end of the year and do your budgeting in November for the next calendar year, a little easier for you because you still have time to get it in your budget. So you can call us, we can talk about what those budget parameters might look like. It can be helpful to you. So this is going to be another annual budget item that you're going to have in your facility. And the legislation also requires experienced trainers. There's not a big menu of training providers in this country. And some of your continuing education platforms might be scrambling now to put together programs to share with you. We don't know, and we don't have a process. The Department of Health does not yet have a process for validating who is certified, who they will certify or who isn't. But there are a couple vendors that we do know, us included, that we can share with you, like Sage National, who have long time experience in this kind of work. Between us and Sage, that they're really the two organizations that have the depth and complexity of training that we would recommend. But if you come across a training program and need help evaluating if they'll be appropriate and if the Department of Health will sign off, as the devil in the details, as the rules and regulations become more expansive, we can all help you determine who would work for you. So an experienced training vendor, initial training for 2 key staff, direct care and administrative care. I'm sure you're all thinking right now who that will be, so jot down those ideas. They have to be in person. So the first two people, the people responsible for your program, for setting up your training and helping your administration implement all the tasks that are going to be included in making your facility align with the legislation, that needs to be in person. During this pandemic time, with this public health pandemic, we were able to get an agreement from the Department of Health to do these in-person uh, uh, sessions as live webinar, live talking to you, chatting, taking you through the training. That is still in effect. We don't know when we'll have to go back to the live in person, because the live in person really enhances the discussion, enhances how effective the training is. I'm sure you've all experienced it in other kinds of training. So we'll let you know when that happens. Our expansive statewide team is available, vaccinated, ready to do live training if you want to do it in person, and we can talk about that offline, and you can email us. Subsequent training platforms, all staff, vendors, none of that is determined by legislation whether or not it has to be in person or can be online. We have a complete training modules online to be done online. Sage does also. We prefer in person, especially for residents and families and community and healthcare providers. So we're prepared to do all that for you. Let us know. And you have to ensure, and I was talking about this before, that your providers include all the requirements of the legislation. So you can contact the health department, you can contact the long-term care ombudsman's office, you can contact us, and we'll help you determine if a vendor meets those requirements. How to schedule this training. So I told you how fast this is coming up now. We've all been busy with the pandemic. So initially, the day it was signed, we were hoping, we could get this out to everybody, but we're all overwhelmed. So now the clock is really ticking. So the next training webinar that's happening, our company, LGBT Senior Housing and Care, is doing it for the New Jersey Hospital Association. And you can, we're doing three 90-minute sessions, 3 weeks in a row. It will meet the requirements of the live training, so you can log on to them if you want to do it that quickly. If you want to wait until September after the summer, we're doing 2 sessions at the end of September. So they're going to be longer sessions, 2 weeks in a row, 2.5 hours, because this initial content with discussion takes about 5 hours altogether to really understand how to start the program. So we're going to send out a notice of those 2 trainings. If 2 works better for you guys, you can log on to that one in September. And also, of course, we can do custom webinars for you. We can come in person. We can work with your physicians and your MSWs and your nursing staff. And like I said, on site for resident families and communities. We have a lot of really interesting programming. So whether your intention learning about this legislation is just to meet the requirements of the legislation and get it incorporated, we can do that. Whether your desire is to really create an LGBTQ older adult long-term care destination, that's a whole other process, and it's really interesting, and we can do that. It's called our 12-step certification process. And that's a choice, that's a choice to really market to the community as well. Let's see. This is our pathway: assessment and planning, training and education, integrating to community life and communications, creating strategic partnerships with the LGBT community, advocates, healthcare providers. We don't want you to have to reinvent the wheel. If we can connect you with sources where you can get the services the community needs, technical assistance and continuing education will lead you to have a really affirming and welcoming housing and care facility for your LGBTQ residents. This is our contact information. We can help guide you along your journey. We're really excited to help you. So thank you very much. We're going to turn the program back to Lori and Amy. Are we back, ladies and germs? Okay, so I know there's probably a lot of questions. I'm going to shoot the first one to Amy and Lori, you decide. How is this program going to be monitored? How are you going to let long-term care communities, know what they need to do to meet the tenets of the legislation?
Right. Thanks for that, Amy. And I do want to emphasize not just that this is a requirement and you have to do this, but what you talked about as a destination, it's also an opportunity. It's an opportunity to create a welcoming environment. So it's kind of an exciting opportunity. And it sounds like there are a lot of great resources available to long-term care facilities that really want to do this, not just because it's required, because it definitely is, and we will certainly be checking on it, but because it's such a great opportunity. So there's a few things that we're going to be doing. Obviously, we're going to be training our own staff, right? So we're going to be going through this training because, like everybody else, we need it. And we're going to have specially designated staff within the Office of the Long-Term Care Ombudsman's office who will specialize in responding to these types of complaints. The way that the long-term care community, that would be the facilities, become aware of it is obviously through their associations and organizations, right? Through the publicity around this when the bill was signed. We will be doing some direct outreach to long-term care facilities to remind them that this is becoming, it will be operational in the next 6 months or so, well, less than that, 3 months. But we will also be working with our partners in the LGBTQI community, including Garden State Equality and other organizations, to help us craft outreach materials that will go not just to long-term care facilities, but also directly to residents. Also, for those of you who are familiar with the long-term care space, in our current statute, long-term care facilities are required to have a poster that hangs up that says, talks about abuse, neglect, and exploitation and where to report that to us. We are working through doing a poster similar to that speaks to the issue of the LGBTQI community and the Bill of Rights and residents' rights under that. If we get a complaint, we would handle it operationally the way we handle other complaints. They can come in through the phone and, fax us, email us. We get a lot of email complaints. And then our protocol is to open that case in our case management system and have one of our designated investigators who has been fully trained to respond to that. And the first thing they will do is call the resident, go and visit the resident and talk to them about what's going on. And use their training to develop an appropriate response in partnership with the resident to solve the problem to the satisfaction of the resident, which is actually our federal standard. If we identify that there has been a violation of that resident's rights under federal nursing home regulations or under the state law here, the Bill of Rights, we have a process. We have a partnership with the New Jersey Department of Health where we will contact them immediately. We will do what's called a referral to them and say, we think there's actually a violation of federal nursing home regulations here and also a violation of this state law. And they are the regulator. We are the advocates, but we have advocates who have the Department of Health standing right behind us. And they also are the ones who can go in, investigate, and they can actually cite deficiencies and ultimately could potentially fine or curtail admissions. So that's kind of the leverage that we have, is that the Department of Health, we work in strong partnership with them. So if we identify an issue, we might refer it to them. But most of the time, what we're going to try to do is solve the problem, do the education, make sure that this doesn't happen again. That's our sole purpose in being there. We're resident centered.
Excellent. Great. Amy, do you have anything to add?
No, I mean, I think just in terms of monitoring that, our staff has a continuous presence in most of the long-term care communities. We have a volunteer advocate corps that's active in the long-term care space. So we will be looking for the signage. We're going to be asking residents about, what's going on in the facility. We'll be talking to staff about training, how that's progressing. We're just going to add this to kind of our menu of things that we're inquiring about every time one of our advocates goes into a long-term care facility.
Right. And we'll be advocating that the state survey agency also look at this as part of the survey process.
And I get as the details of how we administer this evolve, that'll come out of the Department of Health, correct? So we'll get more information as we're training and implementing in our communities. We'll be continuing to get more specific information, correct?
Right. I mean, this is part of, again, they're the regulators. So it's really important that this be a priority for them as well. And they have a lot of priorities and they have a lot, but this is obviously a really critical one. And clearly this administration, the governor signed this, they're very committed to this. And so I'm sure, I can't speak for the Department of Health, I don't think they're on the call, but this will be part of what they will be looking at and supporting. So if we refer a case to them and say this was not handled appropriately, the training requirements were not met, that's a referral for regulatory action. And we will be making those referrals if we find, in fact, that there are long-term care facilities that are not meeting the training component, that are not treating people with dignity and respect. We will be making those referrals and we expect them to be verified and the appropriate action to be taken. But again, we're hoping that most long-term care facilities will see this as an opportunity.
Right, right. I neglected to say that Director Louise Rush from the Division on Aging sends her regards to everyone and is really excited to delve into this work as well at the division. Yeah, Jim McCracken is on, and I forgot to say that the training we're doing for the New Jersey Hospital Association is in partnership with New Jersey, Delaware, because New Jersey and Delaware are now together in a little regional pact, Leading Age. And we have a booth at the Leading Age Expo, which is also the conference, and it's later in June. And Jim, if you want to type in the dates, because it's escaping me, but we'll be there. It's also with Leading Age Pennsylvania, which is exciting. So little regional effort so people can, visit us at our booth and learn more. This presentation will be there. And one other thing, I named incorrectly the program at Garden State Equality for Elders, and I'm going to do it again, Richard, if you don't type right into this box. Fresh, the name of the program. Bianca, you wanted to share something?
Yeah, I just keep seeing questions around the availability of this webinar or the availability of these slides.
Yeah,
We're
I
going
have quite a few questions, Amy, for sure.
Okay, yeah, I'm going to post this on our website, www.lgbtseniorhousingandcare.com. It'll be there by end of day. So anybody wants to log on and review it or send it to others that could not attend today, please do so. And
One other question, Amy, that I definitely have from Jim, actually. The training sessions in the summer, fall 2021 are joint programs sponsored by NJHA and LANJDE.
Yeah, I just covered that.
Right,
New
okay.
Jersey, Delaware, leading age, absolutely. It's 3 sessions. They're 90 minutes each for a total of 5 hours. We have found this initial training for the 2 lead people in each facility. This is the minimum amount to cover all the material that's covered and to help you plan, do your training worksheets. So we're going to do it in 3 90-minute sessions in July with New Jersey, Delaware Leading Age and New Jersey Hospital Association, but log on to New Jersey Hospital Association. I think I have that link on the worksheet. And then we'll send out a memo about dates, a constant contact, start opening those. That's how we communicate. We'll do 2 sessions. Some people can really, only schedule 2 sessions, but there'll be longer sessions, 2.5 hours each, subsequent weeks at the end of September, after all the Jewish holidays and the other holidays. And we're, when our tans are fading, we'll be ready to get back to it.
Also, Amy, there's another big question. Does legislation say how many hours are required for these trainings?
No, just that we have to get through the material. So some organizations that provide training, we like to keep our training to an hour. We like to go online and knock it out in an hour. And this training cannot be done in an hour. So if your program and your educator is offering you an hour, 90-minute training program on your platform, it's just not going to give you the results you need for sustainability. That being said, remember, Department of Health has not made a ruling over which vendors are approved to give this, and there's no time limit on it. So that's one of those, loopholes that we haven't dealt with yet. But what we can tell you is that, we're training the state, so we're certified. And what I can tell you is SAGE, who is the national organization, who, we love to emulate and improve, but we love them. Yes, they are absolutely the work they do, but anything for an hour, you're not going to get it in an hour. And Amy, the 2 people that are trained at the facility will not be training others. They'll just be putting together the plan. And for that, you really need the technical assistance of, a provider to help you figure out who, and it will be on our training worksheet. We have recommendations on the training worksheet of who you should try to train first. And you can do it in order and go down the list and schedule so that you're covering your facility with some continuity. But each training won't necessarily be the same. So you need a provider that gives you all the foundational work, but then, your dining staff does not need to know all the healthcare disparities and morbidities within the acronym, but definitely your direct care staff does. So each training will be, we customize it to each different department as well. So the foundational work is all the same: terminology, history, overview, intersectionality. Applying it to the different departments really is a customized skill. Any other questions, Kat?
Yes, I have Dawn who's asking, so please confirm that the administrator and one other direct care staff person must attend the training and then train the rest of the staff. So again, kind of what you were just.
No,
Yeah.
no. Must attend the training, a live training. Is not responsible. You're not responsible for training the staff. The professionals will train the staff. You're just responsible for filling out the training form. When the staff is trained, who's going to train the staff. I assume your ED will be responsible for budgeting that. We have a worksheet. You'll fill it out, and that will help guide you. You do not train the staff. You do not share the information. Everybody has to be trained by a certified, experienced trainer.
The point, I want to jump in. The point of having one person from the direct care and one person from administration trained live is to have two individuals in your facilities who have an understanding of how the welcoming and affirming environment can be conceptualized for your facility. The one in the direct care understands the needs of patient care components, and the one in the administrative side understands what it will take to get the forms, the contracts, all of those ideas. So as the training is being done by the outside vendor that you're contracting with, right? You've got these two individuals that could be working with the training group in order to figure out how it's going to be implemented. But in order for that to work, they have to be trained first, and they have to be in-depth trained. And if we just picked an administrator, they generally don't understand all the nuance of direct care. And if you pick a direct care person, they generally don't understand the nuance of the fiscal, of all of the, admin. So that's why we wanted two, and then the two work with the training team to figure out technical assistance concepts. They are not training the trainer. We are not doing that. That's not the point of it. The point of it is to figure out how to holistically get your facility to be a welcoming, affirming environment. Does that make sense?
Yes.
Another question here from Darlene. Do you think, or do you find it helpful for the staff person trainer to come from one of these communities? So I guess what I'm understanding is it better for the person to be in-house or outsourced?
No staff person is going to train. So the only one who's going to train is a professional trainer. You must, as part of the legislation, choose someone from the administration staff and someone from direct care who will be trained first, and they will help create the plan for training everybody else. So
the individual doesn't need to be LGBTQ. They need to be somebody who genuinely is an ally and wants to see the facility be the best affirming facility possible.
Correct.
If they are LGBTQ, great. If they're not, but they have a desire and a passion for making certain the facility is LGBTQ affirming, great. That's who we want to be chosen. Don't choose someone who's resentful of having to do this. That's not who we want. We want someone who really thinks this is a good idea.
Yeah.
And it should be noted that you don't want to, just because someone is LGBTQ doesn't mean they're knowledgeable about the nuances of this work. And it's also really important to note that you also don't want to overburden an LGBTQ person that you know to talk about the marginalization and the history and the oppression that they've experienced. And, that's why David said, like, you're looking for someone who's knowledgeable, someone who's studied this, someone who practices, keep the best practices, the same way you would want someone that's very knowledgeable about other healthcare disparities that exist for other marginalized groups. That's the most equitable way to make sure that this information is being communicated across your facility.
And we'll train them. So even if a person's just open and woke and wants to, do this, that's the person. If the person has, social, religious, or cultural biases that make them, concerned, then they need to do the training, but they shouldn't be your two assigned designated persons per the legislation. And you will need a third person in the loop because you know how it is in the business, right? There's a lot of turnover. So we suggest you train 3 people at the top. It doesn't cost you any money, and then any more money in a training session from us. And then you would, always have the third person, the alternate, in the loop. You'll never have a hole in service providing.
Which brings me to one more question from one of our friends from Spring Point Communities. So if we have multiple communities, we have to designate 2 staff per community,
Yes,
correct?
yes.
Also, does assisted living have to do this too, Amy?
Yes.
Okay.
All size, all configurations, all service deliveries of long-term care communities, from rehab all through the continuum of care. The legislation does not designate independent living 55 and over type communities. But if you have a continuum of care community that includes independent living, yes, all providers, even in independent living, must be trained.
And I also have a pretty fair question. Can you provide a general estimate of training costs for various size facilities? Example, 100 to 150 beds. As revenues are lower this year and expenses higher due to the pandemic, we will need to be creative in reallocating funds. Fair enough.
Yes, creative thinking at this juncture will be required. But you know what? In my experience in long-term care, we can get pretty creative. With our company, we'll customize. We have, our trainers are LGBTQ community members who need to be financially secure themselves, and we pay them to do the training. That being said, we customize our programs to fit any budget because we really are on a mission to get this work out there. So in-person training tends to be a little more dear than online training. So we can talk about whatever your needs are. Just email me and we'll begin the conversation. And there's a lot of different options.
And Amy Brown, thank you so much. I know that you put this on the chat, but if you can just go over what you just said in the chat. Long-term care facility means.
Yes, I just cut and pasted from the definition section of the legislation itself. So this bill covers nursing homes, assisted living residences, ALRs, comprehensive personal care homes, residential healthcare facilities, or dementia care homes. Basically, anything that's licensed as long-term care under the Department of Health is included.
Yeah.
Thank you. Yes, I think that that's a lot. I know in the work that I do, I think the verbiage, it gets people confused. That's not us. And I think, I think somebody from home care is on the call here on the webinar. And I think that'll eventually have to trickle down that way as well. But it's very interesting. And the last question that I have here is, what's the first thing that should be done in this process? For all our friends that are here, I'm so thrilled to see so many wonderful people from our skilled nursing facilities that are on the call. So a kudos to all our friends, Parker, Allegria, my friend from Harrogate. I haven't seen her forever, so it's very nice to reconnect. So what is the first thing that we should be doing?
Look for the worksheet that's coming in the email, the constant contact email today, and read what it has to say and start filling it out, and then contact us. Until it is determined who will be accepting those worksheets on behalf of the state, we will take them. You can scan them and email them, fill them out, email them back to me, and we will keep them for you as well as a backup moving forward. And whether you use us or not, that we'll hold on to that worksheet for you.
And my good friend here, Brianna, does this include the portable assisted living services as well?
No,
It doesn't. Okay.
no, it doesn't. This does not cover ALP, assisted living programs. This is what you think of as like your traditional assisted living facility.
Okay.
We hope in the future, like Amy or somebody was just saying, so I don't know who, yes, we hope in the future that this will expand to more of the home and community-based services area as well. But for now, it's focused in long-term care.
And just to know that hospitals that are doing this work want to be able to refer patients to services that continue the affirming, sensitive, and trained work that they're doing with the LGBT community upon release. That goes for rehab, that goes for home care services, as well as the LGBTQI community is very tight when it comes to using services that they know, and everybody, communicates with each other, and that services that are certified and trained to treat them with the dignity and respect, especially in their homes, that they expect. So it's a good time if you're a home care agency, a consultant, to do the work and have it, as one of your, marketing initiatives.
This is going to make all of our days, especially you, Amy. It's making me smile head to head to toe. Lauren, she wants to, and we have to have a different conversation, but I do think it's worth sharing with the group. Lauren definitely thinks that this is something that should be definitely implemented with social work students. This is something that, this is the world we live in, and we'd love to have a sidebar conversation with Lauren. Thank you for those sentiments. I know Amy and I have definitely thought about them, like this should be in a curriculum.
Well, it needs to be in curriculum in medical schools and MSW programs, social work programs. It is, if a medical school has the training, it's 5 hours. The latest studies show gerontology is, a discipline that developed in the 80s. It's not the sexiest choice, and it's certainly not required training in that discipline. And it's an elective in social worker courses, and it should be required material. So we look forward to continuing that discussion. We're running a bit over time. I just wanted to make sure that there were no more emerging questions. And of course, email us at info@lgbtseniorhousingandcare.com with any further questions. And if it's a question directly for Lori or Amy, we will forward it on. Also, you can get their contact information off the website. Final announcement, Jim did post the dates of the New Jersey Delaware Leading Age Conference. And as you know, Leading Age is an organization that represents nonprofit care communities across the nation. And New Jersey and Delaware Leading Age is the one here that takes care of our state. And their conference is on the 16th, 17th, and 18th. Go to their website to register for that conference. There's a lot of exciting information, and come visit us there on our booth. Thank you so much, my panelists. A couple of the team had to drop off early, but Lori Brewer, a long-term care and BUDS person, thank you for everything you've been doing, and keeping us all together this year. And we look forward to continue working with you. And Amy Brown, woman in the know, love you, and look forward to continuing the discussion. And my partner in crime, David Rosen, as always. And Kat, thank you for helping out with the chat and everything. We really appreciate it. This will be up on our website, www.lgbtseniorhousingandcare.com, by the end of the day. Then I'm taking off on vacation. Signing off, ladies and germs. I will answer any email that comes to me while I'm away, so don't worry about it.
Have a great vacation, Amy. Take care.
Thanks for coming, everyone.
Bye-bye.